5/14 this month, Arizona's family investigates fentanyl, where it's coming from and the lives that it's shattered.
We're also talking to everyone from law enforcement to doctors and schools to learn how our communities are fighting this crisis. Cameron Riddle.
Sorry, joins us live in studio to give us one look at how a doctor is making a difference. Good morning.
Thank you. I like the dual intro. Appreciate
we did that on purpose.
Well, 10 years ago, the opioid problem we have now was not the national crisis then. That is because part of that reason is the extremely powerful opioid fentanyl was a drug that you could only get while in a hospital during a major surgery, all of this while under the close watch of doctors. But now that has changed, and doctors are prescribing fentanyl to patients who are recovering from minor knee surgeries, putting patients on a path to addiction and the nation in a state of emergency. Valley doctor Matthew Crooks is working to curb a problem he says the medical profession helped create. His Scottsdale Pain Clinic does not send patients home with loads of pain pills like Percocet and Vicodin, let alone any use of fentanyl. Rather than load his patients up with pills to band-aid pain, he treats patients with a cortisone shot that not only stops pain, but over time heals the pain-causing problem. Crooks' clinic, Pinnacle Pain and Spine, sees a lot of patients with back or joint problems. Those are the same type of patients who end up accidentally hooked on opioids. Crooks' cortisone shot helps to prevent that growing problem, allowing most of the patients to go home medication-free and back to work the next day. Crooks says there is no reason any doctor should be prescribing fentanyl to a patient just going through a simple surgery. He admits the doctors who have are part of the problem.
It's too strong, too dangerous, and again, just like any other opioid, as strong as it is, if your life expectancy is a normal life expectancy, you will become tolerant to that medication, the fentanyl even, and you'll require higher doses of that for the same pain relief. So there is responsibility on the physician's part. Some of it is, misplaced, wanting to help the patient, and wanting to treat the pain and not maybe doing their due diligence or their, their full education in terms of the risks of that medication. And but I do think that physicians do have a role in opening that Pandora's box and allowing that out into the community.
The treatment Crooks gives his patients are extremely simple, and some of them are done in just minutes. Coming up in the next hour of CBS 5 this morning, we will take you inside the operating room as a Valley man is treated for back pain. Hear why he says Dr. Crooks' treatment is a proven alternative to taking any kind of drug.
All right, let's take a look at your traffic, because you know what? We are